people watching, viewers of Internet Things. I'm Bracher Brown, financial advisor over at Edgewater Family Wealth, and I have Akifa with me who can give us a little background on who she is and what she does.
So my name is Akifa Khattak. I am the founder of Qodiva. I'm also a healthcare attorney. I have a health administration background from Cornell and a background in biotechnology from Johns Hopkins.
Extremely qualified, probably more so than anybody in this room. So Akifa reached out. As some of you know, we've been making videos for quite some time talking about a number of financial subjects. And Akifa reached out talking about, more specifically, women and finances and women and obviously how it relates to women's health. And kind of wanted to have a conversation to hopefully address some of those topics and sort of see where there are some misunderstandings or intimidation factors, whatever it may be, that's kind of leading to, I think, what is perceived as maybe less knowledge in the financial realm for women. Is that correct?
Yes, definitely.
Okay. All right. So we have a number of topics that we're going to go through and kind of explore and see if we can come up with anything that makes some sense. So for starters, you were asking about financial literacy, which I think you defined already, right?
Yeah. So, I mean, my definition of financial literacy is having the knowledge and understanding to enable someone to make sound financial decisions that essentially affect their personal finances.
Yeah, and I think that's completely correct. And there's obviously, as with anything, there's degrees of understanding. For the average person, man or woman, I would argue that it doesn't even have to go that far to start making the right decisions. But there's probably a level of, again, you hear jargon and all sorts of acronyms and things that sound more intimidating. They probably really are. The concepts themselves are fairly simple. But there's sort of this gatekeeping of, if I say things people don't understand, they won't ask me about it, therefore they won't do it. And then that creates issues. So kind of highlighting the core components of financial literacy. So we talked in here about budgeting, saving, investing, and debt management. Budgeting is kind of square one, I feel like, something everybody should have an understanding of. And there's a number of ways to do it. The simple version is I make this much and I spend this much. Is that okay? Am I spending more than I save or spending more than I make? Okay. From there, you can get more complex or at least a little more detailed. I use a Google Sheet every single year, and it does a pretty good job. So if you're somebody out there who has trouble budgeting, Google Sheets has a great budgeting tool. And it'll mark things down from either your rent or your mortgage to your car payments, etc. And you just fill in, what do you spend a month on these things? And from there, you input your income, and it'll tell you, okay, you should be able to save this much. And the way I use it is at the end of every year, I go, okay, did I save what I said I was going to save according to what I said I spend on things? And if I didn't, then I either need to adjust that budget because I'm maybe not meeting my goals, or I need to start making some better decisions. So that's the budgeting side of things, and saving is like that. And, you know, savings to save is fine. I think everybody should have some rainy day funds because you never know whether it be a medical emergency or anything else where you need cash. It's important to have savings. Then there's the discipline of, am I saving for something? Is it a down payment on a house? Is it a car? Is it, I don't know what else people buy, but things you buy. Then you say it costs this much. I'd like to have it in this amount of time. If it's $1,200 and you have a year, you need to save $100 a month. It's obviously fairly simple. Investing is, I think, now where we start getting into what is all that.
Yeah, I think so. And so for women, there actually did some studies. I think the Teachers Insurance Annuity Association came out and said that for women, there is a gap in financial literacy. Where women scored the highest was their knowledge in debt management and borrowing.
Right.
So I think about 49% of women in 2020 was when they did the study and the personal finance index questions, and I think 49% of questions were answered correctly by women. So that's less than half of women are answering questions correct. Yeah. So, and their knowledge is, again, debt management and borrowing. I think we have to have a shift now of women need to understand how to invest and how to do a lot of planning. There's a lot of options out there,
Right.
but the jargon, there's some stigmas, there's some biases, and then some women don't even know where to start.
Sure.
I have some friends that are professionals that are pretty tech savvy, career oriented, but they'll come to me and say, hey, I don't know how to negotiate my employment contract. I don't want to rock the boat. I don't know how to ask for a bonus. Some other women will say, yeah, I'm a professional. I get my salary, but I don't know how to invest it. Where do I even begin?
Sure.
So there's definitely a gap there.
Yeah, and I think brief history lesson into today. So, not that long ago, you would have gotten a pension. You didn't really need to know too much about investing. That was more the norm, is your company will say, you've worked for this long, you earn this much. When you retire, I give you this to live off of. Social Security as well. But that has since gone away for the most part. Some sectors not included. But for the most part, the 401k has replaced pensions as this is where retirement is from. And in your 401k, you are investing. Mm-hmm. They try to make it a little bit easy. There are some planning tools you can use on most 401k websites. They're a little archaic, maybe a little too generalized, but are obviously better than nothing. So most of these will say, you make this much, you contribute, let's just call it 4% of your paycheck into a 401k. From there, I get to pick from this list of things I can invest in, which is another topic, because what are they? But it will then say, okay, you're on track then if you want to spend this much money a year when you retire at this age. That's either going to happen or not going to happen at the rate you're going. Mm-hmm. Where I think the confusion comes in is, well, why? Why does that work? I know I put money in here and I buy this thing with a name, but I don't really understand what that is. The first step, I think, is most 401ks have an advisor associated with that plan. It is that advisor's job to educate people on what that means. And I don't know if there's maybe a hesitancy, at the risk of sounding less than knowledgeable, to reach out to that person and ask what it is, because you don't want to sound silly. But that is that person's job, is to sit there in a room with you or on a call with you until you feel confident and comfortable that you understand where it is you're putting your money and why it's expected to do things in the future that help you retire.
So I think my question to you would be, how would you provide that information in a way that's digestible for different generations? So you have someone that's a little more financially literate, they've been in the game a little longer, they understand those things. I believe that Gen Z, according to one of the studies, has the lowest literacy rate, financial literacy rate, as opposed to Gen X and the baby boomers, which makes sense.
It does.
But now, in a world of social media, how do you think that we can reach the younger generation that are new to the job market and they don't know those type of things exist?
I think it's an interesting time to be especially a younger investor because of social media, because there are a multitude of what I think are really qualified and fair, accurate assessments of what it means to be an investor and good education, from these sources that I think is reliable information. The hard part is, especially the younger you are, the more susceptible you are to bad information. Yeah. And it's impossible to know what is good information, what is bad information. And to add to the confusion, that continues on. It's not just on social media. Even in financial advising offices, you could go to 3 different advisors and hear 3 different ideas on how you should approach something. I think the key is to find something that makes sense. If you're going, well, I don't understand it, but they're telling me I'm going to make a lot of money, I wouldn't be so quick to jump into something you don't understand, because when it goes bad, you're not going to know why and you're not going to know how to fix it. Mm-hmm. I lean towards, at the very least, seek out somebody who is a fiduciary advisor is probably the place I would start with. Some people will offer that education for free if you call and say, hey, I have no idea what I'm doing. Can you help?
So how can you, especially for young women, for example, differentiate between somebody that says, hey, pay me this much and I'll help you grow your portfolio, or I wouldn't say it's part of like a Ponzi scheme per se, but those type of dynamics where you have to invest a little bit to get some back that are more credible versus things that are not credible and they fall under scams and all types of different fraud.
Well, for starters, you want to check licenses.
Okay.
So people are supposed to carry licenses to have their job. So personally, I carry a Series 7 and I carry a Series 66. One allows me to trade stocks and bonds and equities, and the other allows me to charge a fee and act under a fiduciary responsibility. So I think you want to start there, just making sure on paper somebody is qualified. Mm-hmm. And then don't settle on the first place you go. Even, I mean, my prospects, I usually say, go talk to at least 2 other people after me to make sure that this makes sense to you and this is what you want to do. And everybody's going to have a different process. And that works for different people. Some people say, take my money, make money with it. I don't want to hear from you. Okay, it's a lot of trust, but okay. Personally, I take more of a planning approach, as most of us do in this office, which is I don't want to buy anything until I understand what you're trying to accomplish. That might work for some people. Some people feel more comfortable knowing, okay, this person understands where I'm trying to go. They're not going to buy things that are inappropriate for my goals. And ultimately what they're trying to do is help me live a certain kind of lifestyle, not make as much money as humanly possible.
What about people that want to start their own business? There's a lot of financial jargon. I guess this is more of a comment than anything, but for financial literacy, they say as you increase your financial literacy, your financial wellness will increase. So your investments, your earnings, your savings. And then that also correlates in a subtopic, which is my interest, financial health literacy, specifically for women, for example. There's so many different financial reproductive costs, for example, fertility treatments. You need to have preventative care, breast mammograms, all types of things.
I think we should first talk about, as you increase financial literacy, what happens.
Okay, yeah.
Some could argue now there's more opportunities. Some could argue now there's more opportunities to get off track. Mm-hmm. I will say not to generalize too much, to women's credit, I've seen a lot of men, especially young men, and some older men, and everywhere in between, who have decided, I'm incredibly financially literate. I understand all these things now, and I intend to take advantage of all of them and get themselves into a lot of trouble because they're convinced they know more than they do, and now they take risks that they're not necessarily understanding, and it backfires. One of my favorite investing, role models, people is somebody who frequents this office, and she was a kindergarten teacher.
Oh, wow.
And I like to think that she's not overly literate. She understands the basics, but her literacy is not through the roof in terms of finances. But she started work, had access to a 401k, made a teacher's salary, contacted the advisor on the plan, said, what should I do? A good relationship with that advisor that continued. They always checked in with each other. She retired a millionaire. She didn't do much.
Yeah.
She just said, what should I buy? He said, I think this is good for your goals. And then they would check in maybe once a year. Is this still appropriate for my goals? Yes or no?
When did she start coming in? At what age?
She was probably in her, I would guess 40s when that relationship started. Probably investing in the 401k prior to that. Let me think how old. Yeah, in her 40s.
Okay.
So
she was, not very young. So she
wasn't 12 years old,
yeah.
and she clearly wasn't making $1 million a year. And I think that's another part that people get confused about in terms of where they stand. I know plenty of people who make a lot of money and do very questionable things with it. And the only reason it doesn't look bad is because they're making enough to cover it.
I understand exactly what you're saying. Yeah.
Right. Their income is so high. One day, will it likely catch up to them? Probably. But that's kind of the other side of the coin. There are people who are not making that much money, who are just consistent and disciplined and simply not making stupid decisions, not making brilliant decisions, just not making the dumb ones.
Yeah.
Who end up very well off, living very comfortable lifestyles pretty easily.
Like picking back off of that, I think that there's a huge area too, if you have your own business, in regards to financial planning. I mean, I'm going to throw out some jargon out there, but I feel like a lot of women, not just a lot of women, but men and women, people, as you were mentioning, might have riskier decisions, or they'll say, okay, well, I'm making this much profit, but they don't take into consideration, is that truly all the profit they made because of their their cost of expenses. There's actually certain strategies you can do for a business that will help actually give you a more accurate representation of whether you're making money and for how long. There's the net present value, there's your weighted cost, average cost of capital, and you can actually put this into a formula, figure out what your total revenue is, figure out what your total costs are, and then see a projection over 5 years of how your growth is and if you're truly making money.
Yeah. And to me, part of what this points to is, I guess, the importance of professionals, right? If you're somebody, I mean, we'll take our CEO, for example. So we're I would consider a very successful company for the last 30-something years. He's an awful accountant, and he knows it. So what does he do? He hires an accountant. He does not let that accountant speak jargon to him because he doesn't understand it. So I think now he's got it down to 2 spreadsheets he sees, because he can understand those 2 spreadsheets and those tell him enough. So to me, there comes a time where you have to know what you don't know, or at least accept that there are things you don't know and hire somebody. I would liken it to, if I said I'm going to go sell lemonade in the parking lot right now, I can probably figure out if I'm making money.
Yeah.
If I said I'm going to go start a business where I have, production costs and I have labor costs and I need shipping, I don't know how to do that. So I'm going to call somebody. I'm going to call an accountant who can tell me, is this working? And that's not to say that I'm not capable of it, but it's not what I do. I think that, if I needed to go screw a hose into a faucet outside, I could do that. If I said I need to install a new sink, I'm calling a plumber.
I think that is a really important point you made too, because a lot of people rely on social media to get their information. And going back to what you were saying previously, it's whether that information is credible. So are you going to someone that, for example, is a financial advisor, someone that's even an economist, somewhere where you know that, okay, they spent so much time learning, not even to the point where they're teaching or giving the advice yet. They spent years of their life dedicated to understanding that topic. And now they keep up to date with that as well.
Yeah.
That's where you want to get your information from, as opposed to social media is great in some regards, especially if it's used wisely, but you have to be careful of the pitfalls. Am I listening to some middle schoolers are really intelligent, but a middle
probably
schooler
more so than me in some cases. Yeah.
So like a middle schooler that is just saying something that as if it's a fact, but it's truly their opinion, and you wouldn't even know who's behind the screen.
Sure.
I even saw one account recently that said, if you do X, Y, and Z, you will get this much money in this much time. And I was thinking there's so many factors here in play that it's almost misbranding to advertise that guarantee.
Sure. Well, and you shouldn't. I mean, if you're in the financial field, that's a dead giveaway that you likely do not carry certain licenses, because you cannot say that.
There you go. So
if somebody's guaranteeing you something, I would be very cautious.
And you know what? I think with social media as well, I mean, this is my own personal opinion and desire a little bit, is that if there was a little label that said fact or opinion or where they got it from, just so that people that are elderly or younger can say, oh, well, this is someone's opinion or this is a fact. This is where they got it from. At least when they're talking about guarantees or educational things that affect people, as opposed to just entertainment. Yeah. And there are certainly some entertaining opinions. There's some entertaining opinions that sometimes are correct. And that's fun and cool. But I think it goes back to, I always want to feel empowered and educated and confident in the decision I'm making. And I can't do that if I don't feel like I understand something. So what I think the thing to avoid is, at least from my experience, is you can say, okay, I think I'm at a point where I need a CPA. I need an accountant.
or I'm at a place where I need a financial advisor. That part's good. I think that's fine if that's where you're at, where you say, I think I'm in over my head now. What is not great is if you go to somebody who then confuses you further. So if I say, hey, I'm at a point where I need a financial advisor, and I sit here and I go, oh, I'm thinking about margin calls on the S&P, and we're going to get an 8% trigger on this product over. What does any of that mean? And the problem is people go, oh, look how smart that person is. I better let them do this because I don't know what any of that stuff means. He might not either. So I think in order to feel empowered to make decisions and to have some at least moderate control over your future, and whether it be an accountant, an advisor, an estate attorney, whatever it may be, you need somebody who's willing to sit down with you until you understand it. And that's something I usually try to impress upon anybody that walks into my office of, I'm going to start. Tell me if I lose you. And we will sit in here for 2 hours if we have to.
Yeah.
But if something gets rocky here and you don't understand it, you're going to panic, and then we're going to have a less than optimal outcome.
That's amazing, actually. I feel like that's the gold standard, right, of how people should conduct themselves, especially when they're providing a service. Not only is the practitioner's license and obviously reputation, at stake or considered, but also you're providing a service where you do want the person to feel comfortable, and you do want the person to feel trusted, especially when it's their finances. Well, I mean,
imagine if I went to a doctor. Now, granted, I have zero experience having females' medical needs, but I'll take something we all have, which, as far as I know, is a heart. If somebody says, hey, we're doing open heart surgery, and they start throwing a bunch of terms at me, is this guy cutting my heart out? What's going on? Versus if somebody comes in and says, okay, these things in your body do this. They're not working correctly, so we have to do this, and here's why it works. Then I'm more inclined to say, okay, cut me open.
Yeah.
But if I feel like you're just kind of throwing a bunch of scary words at me and then telling me you're going to rip my chest apart, I'm probably not going to like that.
Yeah. Well, I think that also goes back to health literacy, right? And this comes from education. This comes from doing things that social media is phenomenal at doing, right? Which is spreading information. But increasing financial literacy literally goes hand in hand with increasing health literacy. So there's a subsection of health literacy, which is a subsection, of financial literacy that is called financial health literacy. And that is preparing for all the different costs and planning for all the various costs that people might see throughout their healthcare throughout their years. Which people don't consider. And I think that especially now, the most important times are times when you don't have time to consider it, which is times of uncertainty. Either there's a death in the family, you might be liable for their medical bills, there could be an unemployment with a job, there could be an emergency with your health, for example. And so those are the uncertain times where you want to already have something in plan. And a lot of people might not consider that when they're talking about finances, but health and finances do go hand in hand, especially the cost.
And especially, I mean, at least for a majority of our clients, and majority of most people, the older you get, also, you can expect medical costs. So I think, one, and I'm guilty of not being super medically literate myself. However, certain things, long-term care, you might want to take a look at some point in the insurance space to make sure you have that covered, but also getting an understanding kind of the full picture of, okay, if I don't have insurance, where does that money come from? How much can they take? Does the government help me? Just understanding kind of the order of operations. And again, this is empowering through education. Once you understand, okay, here's what that process looks like if that occurs, then you decide is something suitable for me to purchase now in anticipation of that maybe happening at some point.
Yeah, definitely. I think with older women, they also are more prone to have elderly abuse, especially if they weren't dealing with their finances throughout their life. So for long-term care, it's not commonly known, but I believe Medicare doesn't cover that unless you're medically indigent. So you have to fall under a certain category. And otherwise, you'll have to go and get the insurance for it.
Which if you are too old and you're starting to think about it, you're too late. You likely won't get insured.
Oh yeah, absolutely. You'll have, lower cognitive function. You want to keep your autonomy, but you don't know where to start. Also now in a digital age, some people can't, don't even know what the options are because they're all online.
Right.
So if somebody's struggling, with trying to use their phone, so how will they know to go into the Medicare website and this is where the resources are?
Yeah, we keep somebody on staff who is both a Social Security and Medicare expert for that reason.
Oh, wow.
Because most people don't, in some people's minds, it's, I don't want to pay for this or I don't want to pay for that. So whatever, Medicare Parts A through Z, 1000, whatever. There's more than I care to count. But they'll come in and say, I didn't want to spend the money on that. And it's okay, well, it costs this, but if you don't have it and something happens, it could cost you that.
Exactly.
Which is, most people don't get that far because nobody told them to.
Yeah.
So it's understandable if I look at it and say, I've never had that problem before. I'm not going to pay whatever it is a month for something that's never happened. Meanwhile, I don't know what the expense is if it does.
Also, there is a bit of a taboo of talking about it, right?
Yeah.
I think now we are more in an age of staying youthful rather than aging gracefully, but with that comes wisdom, and we should be more open to talking about aging, especially while somebody is still alive. I mean, you're going a little bit into estate planning as well in that scenario, but there is intergenerational transfer of wealth, of medical bills, etc. Yeah. So people do have to be a little more open within their families. That's one thing I think I'm very grateful in regards to my own family. I come from a medical background. We're very open with our health, and we're very open about financial planning, especially when it relates to our family. So we think, okay, well, what will happen? God forbid something happened to you. What's the next steps?
Right.
And because of that transparency, it's much smoother when the time comes. So how are you gonna, you have, let's say you go to your financial advisor and you talk about all these things, and now boom, you're hit with a period of uncertainty, which is, okay, well, someone passed, I didn't consider that. Now I have all their debt, now I have all their stuff, and this throws my entire plan out the window. Yeah, no, I mean, it's a valid conversation, and granted, some of them are fairly straightforward if it's a matter of, hey, I'll take a normal example. There's a married couple. One of the spouses passes away, and let's just say they were the majority income earner, and you have a mortgage and car payments. That's an insurance issue, right? If somebody's dependent on your income, you should probably be having a conversation about some form of life insurance. I'm not saying every single form of life insurance is a great idea in my mind, but you should be covering yourself for, okay, what are the things that could happen that would greatly impact the people in my life financially, to where if something happened to me, they would never financially recover from it. Yeah. So I think that's an important conversation to have, and I think the women's health part of it is just so, I'm in not extremely, but fairly male-dominated industry. I think at best somewhere around 30% of financial advisors are women. Oh, wow. I didn't know that. And it might be lower than that. Huh. So it's highly unlikely, mostly because men are horribly financially illiterate, medically illiterate when it comes to female health issues. So I'm likely not the person who's going to be bringing it up in conversation. Have you thought about these things? Because I don't even know what they are. Yeah. So I mean, I think from a financial aspect to the women's health part of the conversation, there's a huge gap. Absolutely. And I think that, women don't even know sometimes what encompasses all the costs. I mean, they might say, okay, I know what the process is for a fertility treatment. I know what the process is for postnatal care, but what does that encompass in terms of cost of care? Right. So the biggest thing first you have to consider is your insurances. You have to understand the premiums. You have to understand your plan. You have to know that the options exist, that there could be potentially a health savings account, that you could have a flexible spending account. Depending on your portfolio, there's tax benefits. There's also certain contribution limits. I think, just talking about the public, not necessarily people that are in the industry, and I mean healthcare and finance. Yeah. A lot of people might not even know about the fact that you can deduct medical expenses on your taxes. Right. Which is a huge thing. Which is, again, and I'm not saying everybody needs a CPA, but
again, the value of, I mean, in here we talk about a team, and especially the older you get, the more this becomes applicable. But what we kind of call the Trinity is a financial advisor, a CPA, and an estate attorney. That should cover a decent amount of your bases.
Yeah.
And all four people, which one of those is you, should all be in communication. Those things should all be aligned. I think, it's difficult if you're going on TurboTax and you had no idea, like, I spent all this on medical expenses, or even in HSA, knowing, okay, I know I get insurance through work, but how much does it cover? What is the coverage? Is this qualified? Is this not qualified? And then to then say, well, what's an HSA and why would I put money? I need the money. Why would I put it over here?
Yeah. I mean, those options are great in some ways, because now you have to look at like the economic aspect of, can people afford these services, right, from the professionals? I think that's why TurboTax and all these different things existed in the first place.
Right.
But in the same token, exactly what you're saying, I think I'm remembering a story. One time I had a friend of mine that called me up and was like, I think I did TurboTax wrong. I owe them like $20,000 and I don't know how to,
I think
what
we
to
all
do
have
with
a
it.
friend who have made that phone call at some point.
Yeah. And I was like, well, first of all, what did you click? And then she was like, I don't know. I think I need to redo the whole thing, but I think I sent it to the RIS. I need some help. And I was like, I think it's too late for now. So you got to take it step by step.
Yeah. Well, and to your point, yes, things like TurboTax and whatever else is out there in terms of financial planning / advising exist for a reason. Because, I mean, depending on what a fee structure entails for one of those professionals, maybe you can't afford it. Or maybe it's not beneficial for you to try.
So what are the options for people that can? So I think there's there's so many different types of people, right? So first you have people in the industry, you have people that are a little more seasoned, and then you have people that are newer into the job market, et cetera.
Yeah.
So what would you say for the different people? For example, for a Gen Z.
Someone's 23 years old. And,
exactly. Yeah. That's, their main source of information is through social media.
Yeah.
And they can't afford having these experts,
Right.
Not all Gen Z, but what would you say?
Yeah, I mean, assuming you're not working somewhere that gives you benefits in the form of retirement accounts, because then you have an advisor at your disposal, whether you know it or not, you do.
See, that alone is valuable information to know.
Yeah, there should be a number to call. You can have that conversation. I like to think there's enough good advisors. Maybe I'm wrong. Maybe I'm being optimistic. But I like to think there's enough good people. I do this because, one, I need to survive. But two, I genuinely enjoy what I do, and I do think it's important. I think it's helpful. So I've certainly had more than I can count conversations with people who, I just had one this week with a 25-year-old. I knew he had no money.
Okay.
But he didn't have a plan either. So we met for a little over an hour and built out a plan. No, there's no cost. Again, not everybody's going to do that. But at least in our offices, that's not an uncommon occurrence where I say, look, this person has no idea. They're starting to make a little bit of money, but they're not sure what to do with it. They might hurt themselves in the process if nobody guides them. So I think you have to try to reach out and at least see how much juice you can squeeze out of somebody. Because otherwise, you're at the disposal of social media. I mean, the education system probably isn't going to help you much.
So I think it's also important to note what you said is the fact that he came in, right? So
yes.
Somebody that doesn't have a financial plan and doesn't have a lot of, a lot to invest might say, you know what, they're not going to spend their time on me. Why even bother? So it's the fact of, okay, well, these options exist.
Yeah.
And I think even in terms of health literacy, the industry, I'm pretty optimistic that there's a big push to provide, healthcare reform and all types of different programs for elderly, for women, for all types of people. But people just don't know it exists and where to look.
Yeah. And I mean, part of that's a marketing problem, I suppose.
A huge marketing problem. Yeah, that's kind of where I was getting at.
But things that are, and I won't go too deep into this because I could talk for hours, but things that are seemingly so vital to everybody, meaning, health literacy, financial literacy, it's not taught. It's not taught at schools. I mean, we went to a school where you would have thought that would have been a class, but it wasn't. And they're probably assuming, well, they're going to learn it at home.
That's true.
Okay, what if you're in a less affluent area? Is the expectation there you're going to learn it at home? Probably not. Mm-hmm. And I'm not saying that's a nefarious thing. I'm just saying it's underserved.
I mean, no, there are statistics and studies that show that minority races do have a disadvantage with financial literacy as well as health literacy.
Right.
And because they go hand in hand, that can also affect, well, one is your investments, your savings, your earnings, but also your care, which affects potentially mortality rates as well, right? Yeah. So I think it's an important conversation to have, and that goes back to access, especially with healthcare. You know, the cost of care is so expensive. So they have tried to make it a little bit of a shift into a little more of a value-based care system. And then there's also patient-centered care. So Medicare and Medicaid, the Center for Medicaid and Medicare Services provided certain rules. One is price transparency with hospitals, right. No surprise billing, and also financial impact data for patients. So with all of this, it's the shared responsibility of the healthcare provider and the patient to figure out what works for them. For example, especially if you're elderly, the overuse of a diagnostic imaging test, right? So it could be out of pocket. The insurance might not cover that.
No, I'm sure everybody watching knows what a diagnostic imaging test is, but let's pretend I don't.
Okay. So
this is only enforcing the lack of
it's okay.
literacy here.
So essentially you go in with some pain and you're like, okay, what's wrong?
Yeah, I wake up like that every morning.
Okay, well, you need to do some stretches then, Bracher. You need to do some stretches. But no, so you get some pain and you go to the doctor and say, well, I don't know where to start. They're going to write up and say, well, based off of your symptoms, we think potentially you might have a certain ailment. But in order to actually determine you have an ailment, you have to go through diagnostic imaging, meaning MRIs, ultrasound, blood work, whatever it is. So sometimes physicians will do that very liberally because healthcare is also a business, right?
There's money to be made. The more tests I run, the more I'm getting paid.
Yes, and healthcare systems, hospital systems are also a business.
Right.
So for somebody that has a lack of health literacy, an elderly woman, she might be like, I have some pain. She thinks that she's going to go in, get some care, but there's a whole side of it, which is the cost. Yeah. And so what the government has tried to put in place are certain rules for the healthcare providers for compliance reasons. Yeah. And so that is saying, okay, look, you guys can't take advantage of these patients. You guys need to work with them, have a shared financial responsibility to say there's no surprise billing. If your insurance doesn't cover it, these are your options. Yeah. So I think in 2019, there was a statistics by Waystar that 30% of Americans know that what the costs are at different facilities for their care, meaning that
I would have zero idea.
Yeah. So, I mean, you wouldn't think, just like you're shopping for a car, you almost have to shop for your healthcare and figure out what's the best in terms of your own personal premiums, your own personal plans, and what you can afford. So there are a lot of things that are out there in the industry, but it's like trying to translate that into digestible information for the public. How is Gen Z going to be able to understand that those are options, and how is an elderly generation going to do that?
Yeah, and I think what a lot of this is coming back to is a willingness, and unfortunately I think it falls upon the consumer or the patient or the client, however you want to phrase it, to seek that out. Right? Because you're saying, okay, somebody's going somewhere and they're saying, I need these things. And the doctor's saying, okay, you need these things. Maybe he's right. Maybe they're wrong. Maybe it shouldn't cost that much. Just like if you go to a financial advisor, they might tell you something that another guy wouldn't. I mean, I can think of a few different types of products that I'm sure compliance will not let me say. But if you walked in and you said, hey, I have this much money, what should I do with it? What I could potentially say to you is, how would you like to never lose money?
Okay.
Good, right? How would you like me to pay you for the rest of your life?
Okay, my background, I think this is fraudulent, but I'm like, what does he want from me? but no,
But
I
that's
do.
the thing.
It sounds really good. It sounds like, wow, I found my jackpot.
Right. Just like if you go to a doctor and they say, oh, well, we can take care of you. We just got to do these things. Mm-hmm. Okay. Well, I'm assuming, they're a doctor. Mm-hmm. Must cost whatever it costs. It's a doctor.
Yeah.
So I think you have to be open to, all right, maybe the first place I go isn't the only place I should go.
Exactly.
I should go other places to see. And again, it's unfortunate that, and it sounds like there's efforts to kind of increase that transparency, but that's who it falls on, and especially somebody who's sick. Mm-hmm. Because if you're sick, you're probably scared. And you're probably not making the best decisions or wanting to take the time to go check out 4 other places to see what's going to be the best for you because you want to take care of it.
Absolutely.
So yeah, I think that's the unfortunate responsibility of consumer, client, patient, etc.
Yeah, I feel like a lot of patients, exactly what you said, they're scared, they don't know where to start, and there is trust within within the healthcare system and with your provider. But in the same token, it's making those informed decisions, which goes back to increasing your health literacy, increasing the fact that the healthcare industry is also a business and also there to serve you, there's certain compliance that they have to abide by, but your providers, it's also their form of sustenance, right? It's their income. It's how they make money. And unfortunately, you have a couple sour apples that spoil it for all the good guys that truly want to make a difference. Yeah. There are some healthcare providers that fall under Medicare, Medicaid fraud because they will add an extra diagnosis of, hey, well, she got dementia. And then they bill it, right? And an elderly patient might not even know that. They might not look at the records. Sure. So it's actually saying, hey, let me look at my records. Let me look at my billing. There was a point where I actually had to have a little back and forth with my insurance company to say, no, I'm pretty sure that this is covered under my insurance.
Right.
And again, the insurance companies, a lot of it's let go. Just like, for example, if you are returning a ticket from an airplane or canceling it, right? Mm-hmm. They're like, oh, well, you just fall under, you're not getting your money back. But there's so many policies that say, well, if you go this route, you could potentially get your money back. So the same thing with insurances. A lot of people get denied the first time and they're like, well, that's it. That's all I can do. But so people need to know that those things exist. And what's the best way at that? I mean, I don't know. I think that's why I'm coming here talking to you too, because it's a conversation that needs to be discussed over and over.
Yeah, I think, unfortunately, the people who are figuring out, okay, there's more than one way are the people who either care enough or are diligent enough. And the people who are intimidated out of the conversation are the people being taken advantage of. Yeah.
That does make sense. And especially with female health as well, there's something called medical gaslighting. And that can happen to any gender. But medical gaslighting is where you don't feel comfortable going to your provider because you're going to get a toxic response. And because of that, you have potentially less accurate care or less appropriate care. You won't share some of your financial burdens or concerns because of medical gaslighting. And then you lose trust in healthcare providers and the healthcare system as a whole. Yeah. So there is a bit of a back and forth because you have some people that say, hey, I'm sore. I want to go to a healthcare provider. You're not thinking about the cost. You think that they just genuinely are there to help you. On the flip side, you have people that are like, I absolutely do not trust the healthcare system, and they're there for money. So, and I think for us, there's a lot of, with our generation too, we have to be aware that there's a lot of economic impacts that we're dealing with. I mean, we can't, there's a lot of people that can't afford rent. There's people that are worried about so many types of things. So they are more conservative, or they would check out things, but a lot of people just don't know where to start.
Yeah. And to kind of the financial literacy, at least, my end of the conversation, after our phone call, whatever that was, a week or so ago, I started thinking, okay, I didn't realize I had some understanding, I guess, but the amount of intimidating topics and jargon and gatekeeping to kind of this world. Mm-hmm. So something that I've been drawing up is just a financial literacy vocabulary.
Oh, wow.
Series.
That's awesome.
Yeah, because I just think it's not as complicated as it's being made out to be. Mm-hmm. And that's coming at a detriment to a lot of people. Mm-hmm. Because again, if I say a bunch of things you don't understand and I sound confident while saying it, you might think, oh, that guy's got to figure it out. I'll just let him handle it. And whether I'm losing money or he's charging me too much or whatever, but you would never know. And so I think that's important that people kind of have that understanding. So I don't know if there's an equivalent of that in the medical literacy or, even on the financial side of medical literacy, a similar resource that hopefully doesn't cost you money to access, to say, hey, here's what's real, here's what this means, here's the things to look out for. No,
yeah, you're absolutely right. I mean, nothing that I can think of in this moment comes to mind, but there's tons of different resources, for people, and I'm sure those exist, but again, it's getting it to the public and getting it to the right people that need it.
Well, I think that's part of what you're trying to accomplish, no?
Yeah. So Qodiva definitely has a mission to bridge a few things. One is knowledge, innovation, and also health. But we would like to do that through credible information. And we would like to do that by bridging the gap between the genders as well, because we are better together. When you have a health issue, it can affect an entire family.
Sure.
It can affect a couple. It can affect, parents, all types of people. So when people come together, put biases aside, then we're able to financially plan. We're able to even assist the person with their health care. So there is a lot specifically about in regards to women's health that men feel like, you know what, I have no place. Like, it's not my business. I'll be supportive, but I have no say. But they're definitely allies, and they should be at the table in regards to supporting their loved ones.
Sure. Well, and I think, it's, whether it be a friend, girlfriend, fiance, wife, whatever, I think if somebody you care about is dealing with those things, you would then start to care about them as well.
Yeah.
I certainly, we had a conversation about certain diagnosis over the phone, which I went 27 years being completely unaware of until it happened to somebody I know, and I thought, well, that's a crazy thing that I've never heard of. Why do I know nothing about that?
Yeah.
It's complete, and maybe it's similar. Maybe I feel the same way about women's health diagnosis and issues that some women feel about finances.
Oh, there you go. Yeah,
that's just not my world.
It's a good correlation. Yeah.
So, all right. Well, I want to take a quick regroup, and we'll get back into some more topics in a second here.
Awesome. Cool. Thank you.
All right, so we are back. Akifa and I are talking about medical literacy, financial literacy, women's medical literacy, women's financial literacy, and everything in between. I wanted to explore, I guess, the gender bias, if you will, in terms of access to financial resources or opportunities and career advancement. So, financial resources, in my mind, there's really only one qualification, and it's usually money. So the resources, I think, are fairly available. I think where the issue maybe comes into play is awareness of said resources. And maybe it's more of a cultural expectation, but as I was telling you, I can rarely go into a social setting, and not just because of what I do, but because it's just what gets talked about, because I'm a guy who's almost 30 years old. Somebody's going to talk about some form of investment, whether it be, my mortgage rate is this, or, my money market account is paying this, or this stock. Did you hear about this stock that did this crazy thing? Those are just normal conversations. Versus, I don't think that's, at least from the women in my life, that's not something they're ever going to come up to me and say, like,
did you hear
they increased the interest payments on my money market account? Like, I can't believe it. That conversation has not happened yet. So I think that's part of it. And I don't, again, as with many of these things, I don't know what the solution there is. I don't know if there's hesitation to get into those conversations from the kind of female perspective of that's not my world.
Well, I think there's so many different factors that go into that. First is feeling welcomed into those type of environments, right? So you have the lingo, which is quite confusing, especially if you don't have a financial background.
Yeah, and I want to make sure I'm clear. Most, at least if you're at a bar and you hear somebody talking a bunch of jargon, they likely have no idea, and they are likely losing money frequently.
Okay, good note.
But at least they know some jargon.
Noted, definitely. All right, the guy talking too much.
Yeah.
Red flag. No, but yeah, definitely the lingo for sure. I think also finding, going back to finding credible sources, also it's a weird construct because you do hear different statistics about there's more women in the workforce, more women are owning houses and things like that. So
weirdly, especially more so than men, I believe, if more single women own homes.
Which, I want to say that in some ways, this is a good thing in regards to like women being a part of the economy and contributing, right? So, and that isn't uncommon. I think people have the misinterpretation that, more women are in the workforce now. But even if you look at World War II, men had to go to war, and women had to go and come into the market, and have the job market. So it goes time and time again because of those periods of uncertainty, and that's on a personal level in someone's life, but also on a societal level. For women, I think that birds of a feather flock together. So if you do have a professional that's in the industry, you might hear her talking about it a little more. It depends also who's, which male figures are there as well.
Yeah.
There is cultural biases. There's definitely cultural biases. There's definitely some people, which is not wrong to believe, but it's just one social construct, which is a man should work and a woman should be at home. Right.
Yeah, and I think whether or not that's the expectation today, there's probably still aftershock of when that was widely the case.
Well, and even from a young age, you're taught different things, right? Even the verbiage from parents might be a little different from a male to a female subconsciously, but they are different. What's important to note is that you have people that are self-proclaimed gurus and relationship experts, but they're, again, people that study their entire life on social relationships and like sociologists, economists of how gender can play a role. And I think what the self-proclaimed relationship people like to put out is one social construct, but there's many types of social constructs that can happen. And I think, for example, in my own personal case, I was really blessed with my father kind of reiterating this one point where I have two older brothers, and what he would say is, for men, both of you guys need education. Men, you guys need an education, but for you, my daughter, you definitely need an education. The reason being is because, God forbid, there's a health issue. Let's say you're happily married, but then, you could get a divorce. Someone could pass away. Now you have kids to look after. What if you don't get married and, you decide you have to look after your parents? There's so many different issues, but a man can go out and they can do like a labor's job. And for a woman, as you get older, it'll be more difficult. So try to get your education, know how to cook and clean, but also get your education. So that way you don't have to rely on someone. It's your choice to be with them. And likewise with my brothers, he would actually say, yes, you do need an education, but also learn to cook and clean a little bit so you don't have to rely on the person. God forbid she's sick or something as well, you can help, but it's your choice to be with that person. I think that's just being a holistic human being. But a lot of, especially an older generation, they might say, you know what, she's being a little too fast. Why is she entering, the workforce? And there's definitely different cultures. America is definitely a melting pot of cultures.
Yeah.
So you have different perspectives, and not everybody is wrong, for sure. Everyone has their own. Your perspective is your reality. and you're very entitled to that way of doing things, your principles, your morality. But I think that's why a lot of women tend to shy away from those things, because the push in the media is, hey, look at your aesthetics, right? Your value comes from your outer appearance.
Right.
You can even monetize off of that. And then on top of it, you have to be a homemaker, etc. But I want to be optimistic. Like I said, we are doing fairly well. And I think the thing is, it's not men versus women. That's
Right.
the whole point. Like, we're better together. So
Yeah.
I want that to be the take-home message.
Yeah, no, and I think that's clear. I think it's, just as much kind of opening a seat at the table a little bit, when it comes at least to the financial resource conversation and that sort of thing. Yeah, I don't know. I've certainly seen elements of, the boys club sort of thing.
Oh, yeah, for sure.
But I've also seen the other side of it where it's like, well, I don't want to hear about this. I don't care about this. And it's like, I know you don't, but like you probably should. It's not always exciting or even all that interesting, but it is in many cases, especially, again, we talked about you've gone from pension to 401k. Your company used to know that sort of thing for you. They no longer do. You have to be somewhat financially literate if you want to start having conversations about stopping work eventually or saving for certain things. I mean, the responsibility now falls on you, and that, I think, includes both men and women. So be willing to have the conversation as well as be willing to open the seat. You touched on divorce. So I want to revisit that because obviously I would imagine, depending on how you look at it, at least from a financial standpoint, many women are impacted by the aftermath of a divorce.
Oh, yeah, men and women, definitely.
Yeah. But I think the probably more stereotypical version that I want to discuss is somebody gets married. In the case where, I guess we'll just say the father is the primary earner, or maybe they both were, but you can live off of the father's income, and somebody, you can start a family. Okay, the woman's going to stay home and watch the kid. Okay. But that's kind of valuable time in terms of career advancement that a woman's now not getting to take advantage of. And so the downside to that is if there's no agreement in place, hypothetically, she gets, maybe some alimony, I guess, but for whatever amount of time and however that's decided in the court. But to me, I mean, that's if that's what you're going to do, and certainly I'm not here to argue that raising a child is not a full-time job, but if that's how that's going to go, then you probably need to have that conversation earlier than later, I think, because I don't think it is fair to say, hey, I'm going to cost you X amount of years that are crucial to you advancing your career, therefore your income, therefore your retirement. And if it doesn't work out, I'm going to get the benefits of me having that time because you were watching a kid.
Oh, yeah. And I think the court also takes that in consideration. They have like your lost earning potential.
Right.
There's certain factors in a divorce, depending on the state, approximately like 10 to 15 factors that they look at. And one of them is exactly that. I think that the solution there is transparency.
Yeah.
And when you're going into a marriage, just like so many other things, like our finances, we're not given a guidebook.
No,
on
and it's
how
taboo.
To. Exactly.
Yeah.
It's taboo, but actually it's the kindest thing you could do to someone, especially if the prenup is equitable or,
Right.
you drew it up with empathy in mind, of course.
Yeah, you'd rather do it when you still like each other.
Exactly. Well,
Yeah.
yeah. So it makes things easier. But no, so for a prenup, it would be super important for couples to have one. I think people need to destigmatize prenups. I think it has been over the course of the years, especially because now people are unfortunately understanding that, sometimes marriages don't last. But when people go into a marriage, that's where they should have that pre-marriage counseling and talk to a financial advisor and say, look, some people get surprised and are like, oh, wow, I married you. I didn't know you had this much debt. And you're like, well,
Yeah.
you should have had that conversation, a little bit earlier. Some people withhold information for sure, but it comes back to that transparency, laying it out on the table, seeing how you guys can combine a life together where both people prosper.
Yeah, and obviously in kind of the marriage and starting a family realm, there's multitudes of other financial considerations outside of just divorce.
Oh yeah, of course.
There's first of all, you're getting married, so that sounds expensive. Actually, I'm getting married this year, so I know it's expensive.
Congratulations.
Thank you. It is expensive. But even past that, you get to a point where you say, maybe I'm going to start a family. And maybe it's an instance of, if you're fortunate enough to where one person can make enough money to sustain the family, whether that's a husband or a wife or whatever, if my fiance said, hey, I got us, then it makes more sense for you to stay home. All right.
Stay-at-home dads.
Yeah. If John Lennon could do it, I can do it.
Yeah.
So, there's that part of, okay, if you're really letting a social norm kind of dictate your financial situation, meaning if I have a wife who makes more money than me and I insist that I be the one to work because that's what I'm supposed to do, that's ridiculous. If she's making $80,000 a year more than me and I insist that, no, you have to stop working because I'm the guy, that's ridiculous.
Well, here's the thing. I think there's a little part of that comes from ego, and it could work both ways, women and men, because I'm very big on both people having accountability, both people holding themselves out, with empathy and also transparency.
Yeah.
And I think the biggest thing there is the transparency, having those conversations, especially a lot of people now are not opting to get married, right? Because of the commitment. And when it means commitment, you're responsible for that person financially, emotionally, health-wise. So is it our medical bill or is it your medical bill?
Yeah.
As opposed to dating. So dating, you can have things a little bit separate. Now, when kids are involved, that's always going to be complicated.
Right.
But when people are going into a marriage, they have to understand it is a negotiation. It's literally a marriage contract. And you have to come in saying, hey, well, I am so-and-so, these are my assets. And when I mean assets, I also mean, their baggage essentially too, financially. I mean, I don't want to, maybe we can edit this out, but children are not baggage, but if they have children, they are costly.
Yeah.
So
expenses,
they're
hidden fees.
Expenses, hidden fees. Yeah. So, are you a liability or are you an asset to me? When people are dating, they could weed out people and see what would work for them, rather than just going off of feelings, but also because especially in a marriage contract, you are coming together, you made these vows, and it's through sickness and in health. It is through thick and thin, and people need to honor that. It's quite difficult, though, in this economy because in some regards, now you have everything kind of working against you. You have two people having to work. Maybe the hours are really long. Now, instead of having mom and pop shops, you have corporations. Corporations require people to go overseas, to go further out. You might not see each other. And then the grass is always greener, sometimes on the other side because of social media. And I think just as we have a regular life, we have an online life now. It's so integrated. And for those that say that it's not, who cares about online life? That's not true because your finances are online. Sometimes people's jobs are online. Most of the time we're on the computer screen more hours than we're not. So you don't know who's coming into your life, so to speak. If you go to a bar, someone might be talking to you, but someone can DM you on your inbox. So it's that transparency. I mean, everyone's entitled to their own. Some people say it's an invasion of privacy. But if you're married to someone and you're like, I'm going to lay down next to you, I'm literally investing in us, I should also know what's happening in your online life as well. So there's so many things that can affect a marriage.
Sure.
So that might, contribute to a lot of the things that we've been discussing here today.
Yeah. Well, I think the money thing is so taboo. And I just think of I feel like in most relationships, you kind of inch towards transparency.
Yeah.
Where maybe buy something once and how can they afford that? How much do you make that you can afford that?
Oh yeah.
And then the next thing is oh, how much do you have? Oh, you have that in savings? How'd you save all that money? Is that normal? Is that a lot? Is that, I feel like there's steps to to being honest about like, I make this much money.
Yeah.
You know, like 2 years and you're like, this is my salary.
Well, you know what? I feel like guys are a little more closed about it. I feel like than women.
Well, because I mean, it's
because your value sometimes is associated with how much you make as a man, right?
Yeah. Well, I think there's in a lot of cases like competition factor.
Oh yeah, for sure.
And you can correct me if I'm wrong on the other side of things, but I think for men it's like, well, I'm not going to tell him because he might tell me, and if he makes more, then like, what am I doing? Versus the other side where I think there is, and we kind of touched on it earlier, the idea of like, what should, you know, as a woman, I do this job, what should I be earning? Am I making what I should be making? So I feel like when women are having that conversation, it's more from a not competition space, but from like a education space to be like, am I undervalued? Should I be having conversations about my compensation? One of my buddies, I'd like to believe I'm above this, but if my buddy's like, oh, I'm making, you know, $70,000 more a year than you, I might be like, I hate you. No, but my first thought wouldn't be like, oh man, how'd you do that? What should I be doing? I'd be like, I gotta make more money.
Yeah.
So,
bump this guy.
Yeah. So I think, you know, there's different motives behind the conversation depending on which side of the table you're on.
Oh yeah. And I think also for women, like I said, your perspective is your reality. There's some women that are like, I want to be taken care of. This is what I'm used to, and this is what the person, and you know, they're not wrong for saying that. On the flip side, another woman might say, hey, I worked really hard for my career, and I want to be this power couple. There's nothing wrong with that either, but it's finding a person that's compatible with you, having that transparency. And also, I think with people that are in the workforce and have their careers, for like, I've heard friends, and this has happened even to me, where sometimes men think you're intimidating, especially when you have things kind of put together or you've worked really hard on it. You don't get that same kind of, oh, wow, like I'm impressed. It might be like, I need to do better than her if you're in a relationship, or even, you know, when you're initially dating, just as like, you might not want to share it with your colleagues or your friends. Like, I don't want it to be competitive. Likewise, you're sitting here and you're like, I like this person, but how am I going to tell them that this is what I have?
Yeah, well, I think there's an insecurity there because you probably, you know, this is now getting deeper into, I guess, dating psychology. But
a little bit.
Yeah, I would imagine for men, it's sort of a issue of, I don't want to tell this person that I'm dating how much I make, because what if it's not enough, and that's, you know, they have a certain expectation of me in terms of that. So if I don't say anything, then they can't reject me. Mm-hmm.
So it comes back to the transparency. And, you know, I think with women, for example, we tend to be a little more cautious and conservative in our approaches to things, especially with employment contracts. Mm-hmm. I know some brilliant women, but they're fearful to rock the boat. There's a lot of internal politics. Yep. They're not even sure how to ask for a raise. They don't, like, sometimes when you're going to a job interview, they'll be like, this is what they told me. And I said, well, did you give them a range of what you're looking for? No. Did you ask for any type of benefits? No. What about your non-compete clause? What does that look like?
Right.
So
that's the only time I've ever, to get into the kind of topic of contract negotiation, salary, and whatnot. For starters, I think there's an experience factor where no matter male or female, your first job, you're likely going to be an awful negotiator.
Oh yeah, that makes sense.
Because you have nothing else. It's like, well, no, I need this. I have zero backup plan right now. You guys are the only means of income. Yeah. Now, once, you know, if you're 5-10 years into a career and you go, okay, I know if this doesn't work out, I either currently have a job that I can stay at, I have other offers on the table. So there's just some leverage there to where you can start not necessarily making demands, but making requests at the very least to say, I want these things or else it's not worth my time because somebody over here will give me this. So I think that's part of it. I also think there's a bit of a double standard in terms of whatever behaviors I have in the office, in the workplace, that would point to somebody saying, hey, oh my gosh, he's relentless or he's so focused and whatever. Those same behaviors from a woman
exactly
aren't necessarily going to be perceived
positive.
that way. Yeah. So I think there's a bit of a double standard there, and that's tough. And I've seen somebody recently, she was like a construction manager for the better part of 20-something years. And she was
pretty cool.
She was rough around the edges.
Yeah.
And I had to catch myself because my first interpretation was like, okay, what is all this? And I thought, oh, you've worked in construction for 20 years, and this is your adaptation that got you to this place.
That makes sense.
Is it fair or right that that's the behavior she had to adopt to get to that position? I don't know.
Yeah.
But again, I had to catch myself from being like, oh, why am I judging her for acting like that? That's
Literally
how everybody she's around all day
industry.
acts. Yeah.
It's interesting because I actually remember when I did an internship at this one particular place, and as a female attorney, you also do have to kind of, stand up straight, talk a little bit, with some conviction and things like that for people to take you seriously. You have people that are not only are you not seasoned, but you're a young woman, right? Mm-hmm. And sometimes you're a young minority woman. So you have so many different things playing against you where people might not take you seriously. One particular meeting, I remember one attorney completely ignoring me, like chair on the side, talking to the men, which we were all in the exact same situation. We all got there, we were all had the qualifications to be there. But I think there was some stigma and some cultural, biases that particular person had that it hit me. It really hit me in that situation. And I thought, oh my goodness, it's because I'm a female. This is, he's not considering my legal, thoughts on some topic solely for that purpose. So after that, I realized, okay, this exists. And then after realizing it, it was like, what steps can I do to prevent this from occurring? And that's that adaptation.
Right.
But then you don't want to become too intimidating or aggressive.
Yeah, there's a ridiculously almost invisible fine line to walk.
Yeah. It's like, am I an alpha? Am I a beta? Am I aggressive? Am I too manly and unfeminine? Or am I...
Yeah.
So there's no.
I don't envy it.
Winning.
I do not envy the position, but I can
But I think that's why a lot of women try to stay away from those type of industries, those conversations, like the financial conversations or not rocking the boat. If you have a male advisor and you're working under them, now how are you going to approach them? Because it's a bit of like a authoritative figure.
Yeah.
So those biases definitely exist, but I think rather than talking about the biases, what are the solutions moving forward on a lot of these things, right? The health literacy, how can we bridge that gap in the financial literacy, in all types of things, in the gender bias? I think people know that it exists, but what is the solution to these things?
I think there's so many like social and cultural and psychological variables going on in that conversation that it's difficult to point to one thing and say, oh, people just need to do this and then that'll all go away, And you're also in some cases asking someone to do something that's maybe not in their best interest.
Oh yeah, definitely.
To benefit, whatever, not be a decent person, or I guess you would have to be a decent person to do it. But, you're asking somebody to say like, okay, let me pull out another seat at the table. I guess we're going to have to share some food. Oh, yeah.
That's men and women. And you know what? I think now imagine this, taking it a step further. You're a female in a work environment. You might not work in a female-dominated industry. You already want to prove yourself and say, you know what, I can hang. But then now you have other things that you want to have accommodations for that you can't address. So I'm talking about menstrual equity. That's essentially the disturbances in the workplace because of a lack of accommodations for women's health.
Right.
They actually said that there's a $1.8 billion economic impact for menstrual equity, like let's say, the lack of menstrual equity in the workplace, there's a literal financial impact. So how are you going to go to your boss and say, hey, look, it's my time of the month.
Right.
I feel like garbage, and can I work from home today?
Yeah.
I think people are a bit accommodating, but it's definitely...
I think that's a case by case. I mean, I would imagine that's
Yeah.
not the norm for somebody to say, oh, yeah, of course. No problem.
But it is the norm to have a period once a
Right.
month.
Right. No, I get that part.
And so, I mean, to say, okay, well, just stay at home then, don't work. But no, that's not the solution, right? We have to have more accommodating workplaces and work environments.
Yeah.
And it's the gaslighting, so to speak. It's not medical gaslighting, but it could be any type of workforce gaslighting that you feel like, I can't approach this person. It might not be gaslighting per se, but the lack of comfortableness, right, to speak to someone about these things.
Yeah, there's a lack of comfortability and a lack of, I guess, education as well on the male side, because I can think of quite a handful of people where if a young woman employee said, hey, I gotta go, their first reaction, while they might be uncomfortable enough to say okay,
Yeah.
inside they'd be thinking, well, how bad could it be? Like this
She's not
person
taking it
lacks
seriously.
toughness, and yeah. So again, I mean, there's certainly standards that are being held in one area that are not being held in the same way in the other, and I don't have a solution. I think there's a diagnosis, but I don't know that there's a prescription.
Yeah, that makes sense. I feel like in the healthcare industry, there's a lot that people are talking about in terms of menstrual equity and providing accommodations in the workplace for various things. It could also, I think that recently they introduced Menopause Research and Equity Act into Congress. So that's to assist with women that are in a menopausal state with their workplace. And so there is a push for those type of things. And I think it's great to talk about, but here's one antidote of how this is a very big reality for women. I was diagnosed with endometriosis, and prior to that diagnosis, I had a lot of cramps, but I was also a working attorney, and so I had to suck it up. I took the 1,000 milligram Tylenol, I took the NSAIDs, to a point where it got really bad, 2 weeks out of the month, which is terrible for your liver.
That's a lot of time.
Yeah, and I was in severe pain. I would have to use a heating pad about 5 hours of the workday under my desk for about 2 weeks. I would just sit there and I'd be doing the work, and that was my way of coping. Now, my firm was extremely accommodating. I have nothing but good things to say, but it's that type of work situations that women are facing. There's also, it's not just pregnancy, but you have people that are menopausal. I have had literally an endometriosis physician tell me, surgeon tell me, it was a little graphic, but I was bleeding so much that, but I still had to go to work. But I had to wear like a female diaper, not, which is a heavy duty situation.
Yeah.
And she had to go and perform. But she had fibroids. She needed to go for a surgery. So and that was not the only case I've heard. This is more common than not. Women are like, oh, well, this is normal, I gotta just keep going, rather than saying, you know what, there needs to be some type of accommodations there.
Yeah. Well, and there's also, I think there's also at large some type of cultural conversation in the workplace. And every workplace has a different culture in terms of understanding and empathy. Some people are just bottom line people. Again, I've stopped trying to change people.
Yeah.
But yeah, I've certainly worked for people where I don't care. I don't care if you got cramps. I don't care if you got hit by a truck. You're either here or you're not, and you're gone. And I've also worked for extremely pleasant people where it's even at the slightest inconvenience. Of course you can go home. Of course that's not a problem. So again, I don't know how you fix an overall business cultural conversation on a larger scale, but I think that's also a large part of it. As some people's, and it usually starts at the top, some people's businesses are going to be run a certain way where there's no room for empathy according to them.
Yeah, I mean, to that point, it's not wrong for them to think that in some ways, because they are running a business, and it depends. So is that employee costing the business money, or are, with those accommodations, are they still able to do their part,
right,
and are they still able to bring in revenue, right? So at the time, as a business owner, you're thinking, well, what's the best interest of the business, right? You have to make those business decisions. So it does vary, but it's worth talking about.
I agree.
Right? Because they are showing now it's a legitimate economic impact for these type of things when there are disturbances in the workforce. So having these conversations are great. Getting it to the public are great. And I think actually Gen Z is super...
Oh, they don't care.
Like,
they'll just...
Yeah, they're like, they want to be their most authentic self, and they will not put up with anything. I feel like the boomers, they kind of had to hold it together and have grow some claws in some ways, especially, for example, women that are really high up in the industry. You'll see them and you'll be like, wow, you are a tough cookie, you know? So I think there's definitely a generational change, which is arguably good. The fact that we can do a lot of things remote is awesome, but...
So I want to, and you tell me where I go off the rails here, but going back to kind of the contract conversation, that can be part of, that can be a conversation. What is the culture here? What is the culture where you're asking me to come work?
Yeah.
Because is it a situation where if this happens, I'm going to get reprimanded for it? Is that the kind of company you run, or is this a culture where, we're accepting of that kind of circumstance and we accommodate that sort of circumstance?
And actually maybe even having a certain provision in there in the contract that can allude to that, because I know someone in particular that said, I had this position that was remote, and now they've changed their entire structure that everyone's back in the office, but I only took this predominantly because it was remote and it worked for my schedule, worked for, what I was doing.
Right.
So I guess having those type of accommodations in that contract.
And have it in writing.
Yeah, definitely.
I mean, and I'll end with some horrible stories of my own negotiations to prove that I am equally as capable of being terrible at it. I've had, let's see, the two memorable ones are I've had a job where I got promoted or was asked to be promoted. The question I didn't ask was, what does it pay? It turned out for 8 months until I brought it up, it paid the same thing. Okay. And then by the time I went to go ask for more money, I was informed that I already got a raise. It was nowhere near what I was going to go in there and ask. But I was caught off guard by the fact that, I just gave you a raise today, actually.
Yeah.
I think I maybe got another $500 a year or something. So that was a lesson that I learned. Next time you get promoted, ask what it pays before you say yes to more responsibility, and get it in writing.
There you go.
The other one was a prospective employer said, "Oh, well, what were you making at your last job?" And I made the mistake of being honest. And he said, "Great, that's what we'll pay you then." And I said, "Well, no, wait, I wouldn't have." And I kept my mouth shut because I was an idiot. But
So you live and you learn.
Right, and that's part of it, is you sit through those just awful experiences and go, okay, that went wrong here. Or you get into a position where you go, look, I got stuff to fall back on. I'm going to keep it pretty frank with you. I want this or I'm not taking this job because I have this over here and that over there.
Yeah.
So that's, again, a lot of workplace kind of conversation. The last thing that I really want to touch on is the role of financial literacy in alleviating stress or stress management, because I think money is inherently stressful.
Of course.
Because you need it.
Yeah.
You almost never not need it. So I think, at least on a financial planning standpoint, and certainly on a budgeting standpoint as well, it takes as long as you're disciplined and you follow kind of the budget that you've set for yourself, it takes a lot of the stress out of the decision making. And part of what I just told a younger the person who came in seeking a plan that I knew was not going to be a prospective client but needed help, we had a conversation about, well, how do you make sure that you're saving or investing that much? And it's if you've set goals at the start of the year, you said, this is how much I'd like to save a year, so this is how much I need to save a month, automate it. take it out of your bank account. The second, before you even wake up, I don't want it in that bank account.
Yeah.
And the reason being
Makes
is
sense.
I only have to make the right decision once in that instance, which is to turn it on. And then I never touch it again. Versus if I don't automate it, it's coming into my bank and every 2 weeks I have to count on myself to make the right decision. I'm okay with my money. I will not make the right decision every single time. There will be times I go, oh, look, money. What will I buy?
Yeah.
Versus this doesn't work towards my long-term goals, me purchasing something stupid with the money that was supposed to either be invested or saved. So that's certainly some of my most basic important advice when it comes to saving and investing is if you have a goal and it's a feasible goal, just automate it. Your bank will have a function that will send it wherever you want and say every 2 weeks, it's gone.
That's an awesome thing to know exists, right?
Oh, yeah.
I think exactly what you said. A lot of people will say, okay, I have extra money now. What am I going to do? I can spoil myself.
Right.
And it's okay. People have different types of ways they want to live their life, right?
But work that into the budget. That's the plan.
That's true.
Like I know, there's some of it that's just miscellaneous, or I know I'm going to go on, I think it's reasonable for me to travel this year with this much money. That does not impact my long-term goals. Those come first. I know in order for me to do what I want to do in the future, this much money needs to either be saved or invested. Then from whatever's left, I can figure out my other expenses. It's not, oh gosh, I had more money than I thought. Maybe I should buy something.
Yeah.
Most of my money has a very deliberate purpose. Yeah.
I think kind of piggyback off of that, I feel like when people are planning, it's, again, planning for times of uncertainty as well. Younger people might also fall into the trap of on social media, okay, I like nice things, and so they want to kind of keep up with the Joneses.
Yeah, I love nice things. Most of them I don't have.
Yeah. Okay. Yeah. I mean, well, hold on. No, but it's all putting it in your plan, seeing what you value, and a huge thing is rather than paying for something that you are losing money, why don't you invest in something that will gain money? And I think one thing I literally live by, and I attribute the proudest thing that I've accomplished is, not I've accomplished.
You have a long list, but go ahead.
Well, the proudest thing in my life is probably how my parents raised me. Because my mother was phenomenal with health, with education. She always said, shoot for the stars, see where you land. My father was a completely different background and extremely business savvy and very forward thinking for his culture as well as protecting his daughter. He saw with his sisters and with other family members that, okay, well, this is what can happen if they don't know how to handle finances or they don't know how to do certain things. One thing in particular he taught me that I live by is that there is this gradient. I don't know if you're familiar with it, but it's essentially like a square. And there's financial stability on one end, and there's financial freedom on the other end. Okay. So if you are an employee or an employer, you have financial stability, but you don't have financial freedom per se because you always have to be there. If you break your ankle or break your leg, whether you work for Walmart or whether you're a physician, you have the financial stability, but you have to be there. Yep. What this kind of takes is having experience, and it also is, especially if you're on the higher end of this, an employer, you're going to probably have a professional background. You're going to have some type of degree or education, yep, right, if you have a service. Now, for financial freedom, you're an investor or entrepreneur. So here, you might not necessarily need to go through tons of schooling, right? You can potentially invest, you can make your own business, but you're also financially free. So what that means is you don't have to be there every single day. God forbid, though, your business or your investments don't work out, you don't have financial stability.
Right, the risk is certainly higher.
So how I was raised is that, Akifa, you need to be on both ends of the spectrum. You need to have the degree, you need to have the credentials, have the financial stability, but also then be an investor and entrepreneur so you can have that financial freedom. Yeah. And I think a lot of women might not, and men, know that even exists, and how they use their money will as soon as you buy a car, it's going to depreciate on value as soon as you drive it off the lot.
Yeah.
But if you invest in property or other things, now you have a passive flow of income.
Potentially.
Potentially, yeah. And, you know, the goal is to have a diverse portfolio to where you can have a passive flow of income. You can rely on things, God forbid, especially for in my situation. Yes, I am an attorney, but I had to literally make lifestyle changes after getting an endometriosis diagnosis. So I had to say, you know what? Well, man, it is quite stressful to be an attorney. Right now, a lot of the firms, it would be difficult to manage my health and stress. So I had to also find different other avenues that I can utilize my degree and also, you know, do things I love. But that comes with having a passive flow of income or trying to be a little more financially free. So if you have chronic stress, and that goes back to the stress, you know, topic, if you have ailments or chronic stress, now you want to try to set yourself up to where you can get to that point, ideally, or have a support network to help you out.
Yeah, and I think I will say I think there's caveats with all of that. So, entrepreneurship, not for everybody.
Oh, for sure, yeah.
I mean, Vinny, you're an entrepreneur. How many days a year do you think you are fully not working?
I'm always on.
Yeah.
Yeah. So that's the trade-off. I mean, and that's not to say, you know, eventually the goal of the entrepreneur is just like with buying a house, you have an asset. You've created an asset that is yours. You own it versus you get paid. You have a paycheck and that's good, but you have no asset. You're renting. You're renting money from your employer. Those first few years of entrepreneurship statistically are unlikely to be very fun.
Oh, yeah.
Or profitable.
Oh, yes.
Because you're everything. You are the CEO, you're the finance person, you're the salesperson, you're creative, you're all of it. And then at some point you start making decisions. Okay, can I bring more people on board? What can I start to delegate out? But yeah, I think in an ideal world, if you have something that you care enough about to be on all the time, then yeah, absolutely. Because you're going to go crazy eventually being an employee. Because it's not your vision. It's not something you care about. You're less willing to give it everything you have because what am I gaining from it at the end of the day? Other than as long as I show up, I get my paycheck for most people.
Yeah.
So yeah, but yeah, I do understand and agree that I think for those who have the stomach for it, yeah, entrepreneurship.
Or it could be investing, right? So rather going back to budgeting instead of taking that money and, you know, squandering it, it's investing in things that will help you get to a point where you do have financial stability.
Yeah.
So entrepreneurship, I agree, it might not be for everybody. It's definitely hard work. The rewarding part is you're doing it for yourself. But there's a risk. I think a lot of businesses at the 3 to 5 year mark might not be, you know, even make it.
Yep. That's usually kind of the amount of time it takes to figure out if that's viable.
Exactly.
Yeah.
So there's definitely risks to that. But the fact that people know that these things exist, right, that's where it's critical. Especially the younger generation that's less seasoned that are going and saying, you know what, this celebrity has this nice car or has this nice chain. Let me go and just buy whatever I need to buy.
Yeah.
And even when you are building a business, it's super important to know the different internal strategy of how you're going to use it. Yes, there's the financial aspect, but then there's an operations perspective. So I learned this through some of the programs I've done, and it's a bit counterintuitive, but instead of saying, okay, here are all the things that could potentially get me where I need to go, and this is the most profitable. A lot of people will go that route and say, I'm going to put all my effort into the most profitable thing. But this concept is counterintuitive. It's how can I fail the fastest and cheapest? So you look at everything you have and you're saying, okay, this area is where it would cost me tons of money. So you want to address that first. So the reason for, you know, trying to be pessimistic, but is if you can get rid of the bottleneck, then you are more likely to succeed in what you're going to do. And you can be more conservative in case you can't overcome that bottleneck. And you do have to fail. At least you fail the cheapest.
Right.
But the idea is you overcome it, and then you're like fairly smooth sailing overall. So there's a lot of things even coming into entrepreneurship that people do need planning before they go out and try to do something like that. Yeah. So
yeah, and I mean, there's a abundance of financial considerations with entrepreneurship, and the further and more successful you get, the more considerations there become. And that's why you build a team. That's why you eventually have, okay, I have an advisor who says do this, I have a CPA who says do this, I have an attorney who says do this, and I have me and I say do these things. So, again, not for everybody, but yeah, I think if that's what you're into and you value that freedom and that is your philosophy, I suppose, is a lot of it, and your mindset, then yeah. But it's also, don't be intimidated by it. Don't go into it unprepared. Don't quit your job tomorrow with $2 in the bank and say, I think I'm going to make it.
Yeah.
But plan. Have a strategy. Have cash built up because, again, you're highly unlikely to be profitable for quite some time. So make sure that you can stay alive in the meantime. And yeah, go for it. Some of the coolest people I know are entrepreneurs.
So I have a question.
Okay.
In each of these categories, because they're very, very different, how would you suggest stress management in relation to all of this, and also just in general in health literacy?
I mean, stress management.
That's healthy stress management. Let's just throw it out there.
I mean, everybody's different. I operate at a fairly baseline level of anxiety at all times, so that way when I get into a truly anxiety-inducing situation, I'm already there, which makes it easier not to panic. I don't know that I recommend it, but it's what we're doing. I think in terms of stress management, it's kind of covering your short-term and your long-term. I think that helps alleviate a lot of stress. Again, there are certainly periods of uncertainty, which is why usually in our office, one of the first questions I'm going to ask is, how is your cash looking? Not your investments, not your income, how is your cash? Because I want to make sure, should you lose the job, should we have a weird market, I want to make sure you have enough cash to get through whatever, as you kind of keep talking about the period of uncertainty. I want to make sure you have something to float through that. So emergency funds are nice for knowing that, some people say I like 4 months, some people say I like a year. Whatever makes you comfortable and helps you sleep at night knowing, okay, if an emergency happens, I can cover it. I think that's a good form of stress management. And then I think whether it be paying an advisor a flat fee for a plan, whether it be finding somebody who will do it for free, whether it be hiring an actual advisor to be in a client relationship where that's something that's revisited every time you meet. Having some type of long-term plan, I think, is extremely beneficial for stress management. And especially when investments or jobs or whatever it may be are doing weird things that you didn't expect, to have something to fall back on and say, okay, this still works, I'm still okay. You need some type of metric to tell you you're okay, I think, in a lot of cases, because if you have nothing to quantify it, you're going to start to question, you're going to start to get weird, and you're going to start to panic. So I think financial planning is, if nothing else, great for peace of mind.
Yeah, no, I definitely agree. Financial planning, there's also a lot of programs, right? The government-assisted programs that help people. I believe, I don't know if it's still active right now, but I believe that there's a particular, like the Federal Deposit Insurance Corporation. Yeah, they actually, if they still exist, but they help guarantee that your deposits go into the member's bank. So this is for elderly people. Okay. It's almost like an automation, right? And so right now with AI, there's a lot of companies coming out to help assist people with financial planning that's more automated. Just like as you mentioned, like just clicking a button and having the money transfer out your account into your savings is a great example of that. So knowing your options, knowing that their programs exist, potentially trying to make things more automated for yourself, especially when the company itself has to comply with a lot of different compliance rules. So that overall it should be, in an ideal world, like run smoothly and with your best interest. And I feel like just in general, taking away the fear of talking about finances and talking about health, would be huge in taking away stress, right? Yeah. Like when you don't know what you don't know, it increase a lot of anxiety. But once you have a plan and you feel like, okay, well, now I can work with some tangible things, you can normalize your new normal, you can process things, and you can move forward in how you'd like to go.
It's incredibly frequent, I think, that somebody comes into our office to create what is the beginnings of their financial plan and come in with a lot of stress and are very timid in terms of coming forward with certain information, only to then at the end of it kind of have a big relief moment of, oh, I'm not necessarily on track, but now that I know what gets me there, I feel so much better. Those are all very doable. So the sooner you get ahead of that and know what it takes to get to where you're going, the less stress you have, right? Because you have an easier path to follow because you have more time, so it requires less effort. You just got to be consistent.
That makes sense. And again, these conversations are super important. And I feel like health literacy, financial literacy, even the terminology, coining these words, having it kind of spread throughout social media is important, because then people will take an interest in it. They'll also knowing that you might have more than one option, especially if you're seeing a healthcare provider, if you're seeing a financial advisor, you want to kind of shop around, you can get different advice and see what works for you and your situation, your values, what you're trying to accomplish. And I do have a lot of hope. If we have to end on anything, I definitely feel like men and women together, if you think about everything we've gone through over the generations, we've tend to show that we can overcome a lot of things, and we've worked together to do so. So the fact that some of these statistics are like, oh, well, a glass half full, but you can look at it in so many different ways, and I like to keep it that way, that the glass is half full.
Yeah.
So I think men and women are doing great, and a lot of the statistics say that there is some competency there. I think the younger generation is doing really well with being aware of those things. And when I talked to my cousin, when she was even in middle school and high school, I was like, wow, I definitely didn't talk about these things at your age. And they're very aware. So I have a lot of hope in all of us.
Yeah, likewise. Talk to people. Be transparent.
There you go. Be honest.
All right. Well, I think unless you have anything to add,
it's a wrap.
All right. I appreciate you coming in.
Thank you. It's a pleasure.